I'm Dr. Melanie Palm from Art of Skin MD in San Diego, California, and I am going to be demonstrating Voluma, which is the newest hyaluronic acid product available from Allergan. It's actually from the Juvederm family, and it's meant to be placed very deeply within the skin tissue. So it's meant to be placed on top of bone or very deeply within the fat pads. So we're going to use it for mid-facial volumizing. In this patient, we're also going to use it off-label in the temple area and a little bit along the jawline as well. And so we're going to start off in the FDA indicated area, which is along the cheeks. And we lose cheek volume over time, and when that happens, it causes telltale nasolabial folds and changes in the lower face. So I really want to work on just volumizing a little bit of that apex, the most full area of that cheek. So we're just going to do teeny little aliquots in this area, and you close your eyes for me. I'm going to do a little poke on 3. 1, 2, 3. And so this is a really simple technique. It's just a little small poke. There's actually numbing in the Voluma itself, so it's quite comfortable when you're having it done. I typically, for patients, like to provide them with a little bit of topical numbing. I'm going to do a little poke on 3. 1, 2, 3. And they sit for a little bit so that even that little initial poke through the skin isn't too bad. And then usually the lidocaine that's in the Juvederm Voluma itself really starts to kick in and patients don't feel very much. You want to do very small amounts, and Voluma is actually moldable. That's what's so wonderful about this product. I'm going to do a little poke back here. 1, 2, 3. And so I usually am not doing more than about a 10th, really I'm just doing about a 20th of the syringe at any single point. And then I just kind of use my finger to mold it along this cheekbone. This patient has beautiful cheekbones to begin with, and we're just trying to turn back the clock a little bit by giving her a little bit of that back. We'll put just a touch here, so a little poke a little bit further in. 1, 2, 3. And different techniques can be used. I'm using a depot technique, which just means small aliquots are being placed right on top of usually the periosteum, which is our deep bone in that area, creating a really strong lift with the Voluma. You can also use a fanning technique that works really well with this product as well. A little poke out here. 1, 2, 3. And again, just small little dots to lift that cheek up. And we typically will continue all the way along what's called the zygoma, or sort of your cheekbone. I'm going to do a little dot here. 1, 2, 3. Creating a little bit of volume and thus creating a little bit of lift. And then as I put the product there, we're going to do just a little bit of massage. Little dot here. 1, 2, 3. Good. And one final one back here. 1, 2, 3. After I'm done with what we call the zygomatic cheek, or this part of the bony part of our cheekbone, we can then use it in the submalar zone, which is this concavity here. In this area, I really just put it in the fat, and again, it's just small little aliquots. I'm not going to put very much on this patient. I like there to be, sort of a sweep of the cheekbone, a sweep of the jawline. It's okay to have a little bit of concavity there, just not too much, and I think she has a really nice balance of those two. So we're just going to put a touch there, okay? And in this instance, I'm going to be using a fanning technique, so I can put just a little bit of the product into that subcutaneous fat, so we're in a really safe zone of injection. Then next, I'm going to put just a touch in the temple here, since we have a little bit more to use on this side. So I'm going to do a teeny little poke. The patient may hear just a couple little sounds, and we're going to place it on top of the periosteum. A little poke. And again, you just want to fill really slowly. If you're in the right plane, this just fills very nicely and smoothly into that sort of scooped out zone where we start to lose a little bit of fat in our temple. And by volumizing this area, it actually, over time, can help lift the brow a little bit if you help to re-volumize the scooped out area. And then lastly, I just want to do a couple dots, if you can relax your smile for me. In this area, we have a tendency to lose a little bit of bony support over time, as well as soft tissue. So I'm going to do some very deep depot injections, probably just about 3 of them in this zone, and we'll be done with the Voluma on this side. 1, 2, 3. And again, I'm just using very small amounts, about a 0.05 cc's to 0.1 cc at a time. We're going to do a final one here. 1, 2, 3. Perfect. Now, as you can see, there's very little discomfort with this. There's very little bleeding. They're just small puncture techniques. I'll probably just mold this a little more, but as you can see, it just gave her a nice sweep to the cheek, gave a little bit of volume back here, and created a little bit of volume in her temple. And that's a change if you compare it to what we call her contralateral side, or the untreated side that's over here on her left. So that is Voluma injection. It's really quick and simple. And if you have questions, you can contact us at Art of Skin MD in San Diego, California at www.artofskinmd.com.